Welcome to the Informed Woman magazine, where science meets clarity and knowledge becomes strength. I'm William Bologna. Let's make women's health understandable together.
If PCOS is a self-reinforcing cycle, then treatment is about finding the leverage point, the moment where one small change reshapes the entire system. The right intervention can shift your metabolism, hormones, and ovulation all at once. The foundation of PCOS treatment is lifestyle modification, and it is far more powerful than most people realize. This is where the hormonal loops begin to loosen. A 5 to 10% change in weight can reset key signals. A diet based on whole foods, lean proteins, low glycemic carbs, and anti-inflammatory fats stabilizes insulin. And when insulin stabilizes, androgen levels drop. This is the first place many women feel the shift. Exercise compounds the effect. Both resistance training and aerobic activity improve insulin sensitivity independently. Movement becomes medicine for PCOS. For irregular cycles, combined oral contraceptives are often the first-line therapy. They regulate bleeding patterns and lower ovarian androgen output. The cycle begins to regain its rhythm. Lower androgens mean clearer skin, less hair growth, and smoother cycles. This is not masking symptoms, it is restoring equilibrium. For many women, this alone creates meaningful transformation. When pregnancy is not the goal, cyclic progesterone protects the uterine lining. It prevents overgrowth caused by unpredictable bleeding. This preserves long-term uterine health. Metformin addresses the metabolic engine behind PCOS. By improving insulin sensitivity, it indirectly improves ovulatory function. Its effects accumulate over time. When androgens remain high, spironolactone can help, but it requires careful contraception. It reduces acne, hair growth, and androgen-driven symptoms. It is not a standalone solution, but part of a broader toolkit. For women trying to conceive, letrozole is now the first-line ovulation inducer. It works by lowering estrogen just enough to stimulate FSH release. This helps select a dominant follicle. If letrozole fails, gonadotropins or minimally invasive ovarian drilling may be used. The goal is precision, not overstimulation. Every follicle is guided carefully. IVF becomes essential when other methods don't work. But PCOS requires a uniquely tailored approach to avoid OHSS. Everything must be low, slow, and deliberate. Mild stimulation, antagonist cycles, and agonist triggers reduce risk dramatically. This approach nearly eliminates OHSS while still producing viable eggs. Safety becomes the priority. IVF also lets embryologists select the healthiest embryos in the lab. This bypasses issues with irregular ovulation or hormone timing. Technology compensates where physiology struggles. Most PCOS patients benefit from frozen embryo transfers. The uterine environment is calmer, more receptive, and hormonally balanced. This improves pregnancy success rates. Acne, hair growth, and hair thinning often require targeted treatments. Dermatology and endocrinology work together here. These symptoms are reflections of internal hormonal shifts. PCOS increases the lifetime risk for diabetes, metabolic syndrome, and cardiovascular disease. This is why ongoing monitoring is essential. Treatment is not just about fertility, it's about long-term health. Here's the part almost no one talks about: NK3 inhibitors. They target the brain's pulse generator and slow GnRH pulses. This restores the LH-FSH balance at the root. By calming these neurons, NK3 inhibitors reduce LH output and lower androgen production. This is a non-hormonal therapy with profound potential. It acts at the origin point of PCOS. Early studies show improved ovulation and reduced androgen symptoms. For many women, this could be a paradigm shift in treatment. We are beginning to treat the signal, not just the symptoms. But the deepest question remains: why did this system misfire in the first place? In Part 3, we explore the epigenetic forces that may program PCOS long before symptoms begin, sometimes even before birth.
Thanks for watching another video by the Informed Woman magazine. Please feel free to comment and ask questions. Subscribe for more science-driven medical insights.